The following portion of Daytime is sponsored by Tampa General Hospital.
You're having a baby, and where you deliver matters. Did you know that more than 6,200 babies are born at Tampa General Hospital every year? That's a lot of babies. Safety, comprehensive maternal and fetal care centers specializing in both low and high-risk maternity care truly make a difference, especially during these trying times of a global pandemic. Joining us today to share more is Dr. Judette Louis. She is professor and chair of the Department of Obstetrics and Gynecology at the USF Health Morsani College of Medicine, as well as medical director of Women's Services at Tampa General Hospital. Welcome, Dr. Louis.
Thank you. Thanks for having me here today.
It's our pleasure. With so many babies being born at Tampa General, how is your team handling the volume and ensuring safety, especially during COVID?
It is challenging for sure. We do know that safety is one of the things that really becomes vulnerable when you start getting high volumes. Luckily, as an academic center, we already had a lot of safety protocols in place. We try to not only follow the existing national standards, but we also have a lot of our team members who are part of developing those standards. And so we're confident that we've been able to stay safe because of those past innovations.
It's such a big deal when couples are trying to decide at what hospital to deliver. What advice do you have for people trying to make that choice?
I think it starts with you as an individual family, thinking about what's important to you. But then taking it a step further, birth is one of these unique situations where people plan for it for a long time and they envision what it's going to look like. But I think you also have to look at, well, what happens if it doesn't look the way that I had planned it to look? And so it's important that wherever you deliver, be able to handle everything when it is well, but also be able to handle emergencies.
And is that a hospital like TGH? I mean, you always hear the adjective world class associated with Tampa General. What makes it that as far as deliveries go?
Well, because we could handle no matter what happens under one roof. For those who come in for midwifery care, we can handle that. But if things go awry and we need an emergency surgical procedure, we can handle that too. If moms and babies get sick and they need critical care, we have you covered. And I think that's important for people to consider when they're choosing where to give birth.
You mentioned midwives. For somebody who's considering using a midwife instead of a physician, what are your thoughts on that?
I think the best care happens when you have licensed healthcare professionals that integrate into one system, and that includes midwifery. That for a lot of moms and families, midwifery is the right choice, and I'm very supportive of that. The key thing is making sure that we're talking about individuals who are well-trained, licensed, and you're delivering in a licensed center, whether hospital or birthing center, and that there are clear plans for what to do if there's an emergency.
Are you seeing a lot of babies being born during COVID?
A whole lot. There was an initial decrease in births, and now a lot of us are reporting a boom.
Well, you're ready, it sounds like. So thank you so much for joining us, Doctor.
Thank you.
It's our pleasure. And if you'd like to learn more about the birth experience and delivering at Tampa General Hospital, please visit tgh.org/women's health. Daytime will be right back.
The preceding portion of Daytime was sponsored by Tampa General Hospital.